Infectious disease. Disorders caused by organisms such as etiology, bacteria, viruses, fungi, or parasites. Contagious disease. A communicable disease that can easily spread rapidly from person to person through direct contact, indirect contact, or droplet contact. Are infection and disease synonymous? No. Syndrome. Set of medical signs or symptoms that are correlated with each other and often with a particular disease or disorder. Etiology. Cause. Set of causes or manner of causation of a disease or condition. Etiologic agent. Microorganisms and microbial toxins that cause disease in humans. Bacteria, bacterial toxins, viruses, fungi, protozoans, parasites. A direct factor. Direct factors. Viruses, bacteria, fungi, protozoa, worms. Indirect factors. Contaminated surfaces, mosquitoes, flies, ticks, rodents, dogs, birds. Transmission. When an infected person touches or exchanges bodily fluids with another person. Ways to spread or introduce an infectious disease. Direct contact with infected animals, contaminated feeder or water, contaminated inanimate object, ticks, insects, humans to animals. Pathogen. Bacterium, virus, or other microorganism that can cause disease. Pathogenicity. Property of causing disease. Is an infectious agent's ability to cause disease a fixed characteristic? No. Host factors and pathogen factors should be taken into account. Host factors. Age, health, vaccinated, natural immunity. Pathogen factors. Resilience of disease. Variants. Severity of disease. What affects variants? Adherence to tissue, protections from host defenses, ability to use host resources to bacterial advantage, ability to convert host resources to toxins. Innate immunity. Immunological subsystem that compromises cells and mechanisms that provide first line of defense from an infection. Cough, tears, mucus, skin. Acquired immunity. Immunity obtained either by the development of antibodies in response to exposure to an antigen or from transmission of antibodies. Vaccines. Clinical sign. Objective evidence of disease. Coughing, jaundice, swollen lymph nodes. How can clinical signs be characterized? Acute, chronic, progressive, waxing, waning, pathognomonic. Pathognomonic. A sign whose presence means that a particular disease is present beyond any doubt. Is a clinical sign an indication for treatment? No. Needs further assessment. Lesion. Region in an organ or tissue which has suffered damage through injury or disease. Wound, rash, abscess. Pathogenesis. Mechanism by which bacteria cause infectious illness. Epidemiology. The branch of medicine that deals the incidence, distribution, and possible control of disease. Epistemology. Study of disease pattern in animal populations. Disease prevention. Procedure through which individuals, particularly those with risk factors for a disease, are treated in order to prevent the disease from occurring. Disease control. Reduction in the incidence, prevalence, morbidity and mortality of an infectious disease to a locally acceptable level. Prognosis. Likely course of a disease or ailment of the animal. What is actually causing the problem? Zoonotic disease. Transmitted between humans and animals. Rabies, brucellosis. Veterinary client-patient relationship. Vet assumes responsibilities of making clinical judgments regarding health of animal and client has agreed to follow vet instructions. Extra-label drug use. Treating an animal with a drug that is not meant for that species, using a larger dose than recommended or using it more frequently or administering in a different way than advised. How can we decrease antimicrobial resistance? Preventing disease from occurring, improved antimicrobial use, reducing overall antimicrobial drug use. How are antimicrobials used? Treatment: prophylaxis, metaphylaxis, growth promotion. Prophylaxis. Infection is anticipated or risk warrants preventive therapy. No infection has occurred but it could. Metaphylaxis. Data indicates infection is likely underway but no signs. Produces role in preventing diseases. Management: medical records and past history, physical exam and current history, regional and practical knowledge. Equine temp pulse resp. 100 F 34 bpm 12 per minute. Bovine temp pulse resp. 101 F 66 bpm 38 per minute. Ovine temp pulse resp. 102.5 F 75 bpm 25 per minute. Caprine temp pulse resp. 103 F 75 bpm 25 per minute. Swine temp pulse resp. 102.5 F 95 bpm 45 per minute. Pyrexia, above normal body temp, noun. Fever, above normal body temp, noun. Febrile, pertaining to fever or pyrexia. Hyperthermia, above normal body temp. Hypothermia, below normal body temp. Arrhythmia, dysrhythmia, irregular heartbeat or pulse. Tachycardia, increased pulse or heart rate. Bradycardia, lower than normal pulse or heart rate. Tachypnea, increased respiratory rate. Breath apnea, abnormally slow breathing. Dyspnea, labored breathing. Peristalsis, radially symmetric organized contraction and relaxation of intestines. Borborygmus, sounds produced by spontaneous movement of gas, fluid and ingesta through the gastrointestinal tract. Bacteremia, bacteria in bloodstream. Viremia, virus in bloodstream. Septicemia, systemic disease associated with the presence of pathogenic microorganisms and their toxins in the bloodstream. Endemic, disease present within a population in a predictable, continuous pattern at all times. Epidemic, disease occurrence significantly greater than normal. Pandemic, widespread epidemic. Systemic, affecting the body as a whole. Recumbent, animal lying down and unable or unwilling to rise. What is the value of livestock determined by individual characteristics and performance? What is the success of livestock production directly related to disease susceptibility morbidity rates? What are livestock producers' two major responsibilities: stewardship and animal welfare? Livestock stewardship, producing food by caring for animals through responsible resource management and the prudent use of technology. 5 freedoms of animal welfare: hunger and thirst, discomfort, pain, injury or disease, express normal behavior, fear and distress. Routes of administration: oral, parenteral. Bacterial endospores, formed by some gram-positive bacteria during unfavorable environmental conditions. Metabolically inactive state equals dormant, highly resistant to stresses, preservation of cells, genetic material. Bacterial vegetative cells, present in favorable environmental conditions, metabolically active and growing. Anthrax etiology: Bacillus anthracis, spore-forming bacterium. Anthrax pathogenesis: inoculation, ingestion, inhalation, toxemia, septicemia, hemorrhagic lymphadenitis, tissue necrosis. Spores get activate to vegetative cells. Anthrax transmission: inoculation, ingestion, inhalation. Not contagious, zoonotic. Humans relatively resistance to natural form may develop cutaneous disease, inhalation anthrax or gastrointestinal anthrax. Anthrax epidemiology: periodic episodic associated with drought. Livestock graze too close to ground before forage is low. Ingest spores accidentally with forage flooding. Increase in number of spores in standing water. Water begins to evaporate. Cultivation. Anthrax clinical signs: per acute chronic, fever, GI signs, edema, dyspnea, staggers, convulsions, and sudden death. Ruminants equals per acute, often found dead. No previous signs. Horses equals acute, colic for a few days then dead. Anthrax lesions. Edema, non-clotting dark hemorrhage from orifices, organ necrosis, lack of rigor mortis. Anthrax prevention, vaccination. Anthrax control. Rapid detection, quarantine, post-exposure treatment, vaccination, relocation of unaffected animals, disposal of dead, use of insect repellents, control of scavengers that feed on dead animals. Anthrax morbidity and mortality. Sporadic necropsy equals spores will form when carcass is opened and persist at site and exposed to humans. Clostridial diseases. Bacillary hemoglobinuria. Common name, red water disease, acute, infectious, toxemic etiology, Clostridium hemolyticum. Bacillary hemoglobinuria epidemiology. Soil-borne disease, some healthy cattle sheep carry spores in GI tract. Liver flukes and high nitrate diets increase prevalence. Bacillary hemoglobinuria transmission, ingestion of spores. Bacillary hemoglobinuria pathogenesis. Bacillary hemoglobinuria clinical signs. Acute death with no signs or pale mucous membranes, fever, depression, dyspnea, jaundice, hemoglobinuria, dark red urine. Bacillary hemoglobinuria lesions, multi-tissue and cavity hemorrhage. Bacillary hemoglobinuria treatment. Antibiotics, penicillin and acidotracycline parasiticide if liver fluke is cause of necrosis, for fluids or transfusion depending on severity of disease. Bacillary hemoglobinuria prevention control, vaccination, liver fluke control. Bacillary hemoglobinuria morbidity mortality, sporadic high. Blackleg etiology, Clostridium chauvoei. Blackleg epidemiology. Enzootic, soil-borne disease, cattle and sheep carry spores in GI tract. Epizootics occur after flooding or cultivation, most common in beef cattle in very good health. Trauma, forced exercise, summer or fall. Blackleg transmission. Ingestion or wound contamination, cattle endogenous, originating within cattle, sheep, shearing, docking and castration. Blackleg pathogenesis lesions. Growth of latent spores, endogenous myositis in cattle, wood contamination, muscle necrosis in sheep. Blackleg clinical signs. Acute death, acute, severe depression, fever, lameness, crepitus, swelling in large muscles. Blackleg prevention control treatment, vaccination, antibiotics, relocation. Blackleg morbidity mortality, sporadic, nearly 100%. Toxico-infectious botulism, common name, forage poisoning, Shaker-Foal syndrome. Botulism etiology. Rapidly fatal paralysis of the voluntary muscles caused by toxin produced from the bacterium Clostridium botulinum. Botulism epidemiology. Bacteria rapidly multiply in dead animals and plant material. Bacteria ubiquitous in many environments. Botulism transmission. Ingestion of toxin and or spores, wound inoculation. Botulism pathogenesis. Toxins act on neuromuscular junction and prohibit acetylcholine, high pH, moisture and carrion in feedstuffs, vegetation and toxin production. Ingestion equals intoxication. Ingestion of spores from environment. Germination equals Shaker-Foal, wound inoculation, toxin production. Botulism clinical signs. Horses, cattle, and sheep muscle tremors, progressive flaccid paralysis, death usually due to cardiac and respiratory paralysis. Botulism prevention, feeding management and vaccination. Botulism morbidity and mortality, low and very sporadic high. Clostridium difficile. Types A and B, enterocolitis and diarrhea in foal and horses. Risk factors, hospitalization and antimicrobial use, also spontaneous diarrhea in cows and pigs. Clostridium perfringens type A, B, C. Clostridium perfringens type D.